for me, if I can get the presentation to move. Hold on. For some reason there we go. Okay. I just wanted to start with a brief reintroduction for anyone who wasn't tuned in to last week. So my name is Rachel Davies. I'm a clinical psychologist, and together with Hannah Moncad, who is also kind of listening in and came up earlier, who is also a clinical psychologist, we've been running a pilot project in since September, October time, bringing support for women with birth trauma and with antenatal anxiety, and also providing supervision to mental health and birth reflections midwives. And what was recognised was actually that given the current situation with the COVID-19, we needed to expand the support that we're offering and provide specific support to midwives, other maternity staff on the front line, particularly because it's recognised that there's a huge amount of anxiety and understandable level of anxiety brought about with COVID-19. So this is where this session has come about. It's going to be every Tuesday from 1 till 2 over Zoom. As Hannah mentioned, we're attempting to record it so that other people can watch it at another time, but we're just trying to work out the best ways of doing that. So we're playing it by ear. With these sessions, as I said last week, that these are for you, these are for kind of midwives, other maternity staff who are listening. So please let us know what you want us to talk about, what would be helpful, any feedback, anything that works, anything you think should be different. Please just let us know. We're open to feedback and we really want to make it work for you. So please tell us what would be most helpful. What was raised and what we're going to think about today is sort of the specific kind of anxiety that has been raised about the fear and the understandable fear and anxiety about taking the illness home, possibly making family unwell as well. And as we said before, please stop me, type in a question. Hannah's here to manage it and monitor it. So if anything comes up, please just kind of type it in, stop me, and we'll try and answer those questions if it feels helpful. Okay, so just again, apologies for those who were here last week that we're going to repeat, but a brief sort of summary of what we talked about last week was that we recognise that the COVID-19 is an unprecedented situation. It's something very few of us will ever have experienced before, and it's understandably going to trigger a lot of emotions in all of us, and these include anxiety, sadness, guilt, anger, panic, feelings of panic. And we know that for midwives and other health professionals who are on the front line, that's even going to be even greater likelihood of experiencing those emotions, because actually what you're doing is kind of working with people every day. You can't do the self-isolation in the same way that the rest of us are being recommended to do, and the social distancing. But what we talked about was actually recognizing that these emotions are completely normal, understandable, and that a lot of people will be feeling that way. And briefly, kind of what we talked about is often the reason that we feel those huge amounts of anxiety is humans, we're successful because we have problem solving skills and we can look at a problem and create a solution and move on. However, obviously in this situation where we identify the problem, there is no obvious solution, and that's where kind of anxiety can be brought up, and part of what we have to do is learn to cope with that unknown. So we discussed kind of acknowledging the emotions, trying not to fight them off, but just letting them be, recognizing that we feel that. And we also talked about ways to help us cope, including kind of exercises to stay in the present moment, do mindfulness, identifying what we can control, and to let go of those things that we can't, and taking the time to look after ourselves. And what we're going to do today is think about how we apply those ideas to this specific issue of the anxiety around bringing it from home. What I thought might be quite nice, so one of the things we talked about and raised last week, or identified as being a sort of some of the helpful strategies, was the mindfulness breathing. And I thought maybe if we could just start by actually all doing that now and taking a few minutes just to kind of bring ourselves down, bring ourselves into the moment, and just to sort of let go of whatever's been going on this morning. So if you would all just get yourself into a comfortable position wherever you are, sort of being that seated or lying down, make sure that you're kind of back straight and that your body is as relaxed as possible. Okay, you can do that standing, you can do that sitting down, whatever kind of feels like it works for you. And then just take a moment to ground yourself into the space you're in. So close your eyes, really could just close their eyes, and then just noticing the presence of the room around you. So what it feels like with the air against your skin, what the ground feels like beneath your feet, what your body feels like on whatever it's resting against, the back of the chair or the bed if you're lying down. And then just draw your attention to the natural rhythm of your breath. So you're not trying to change it or control it, just observe it as it moves. Notice it coming in. Notice your lungs filling up as you breathe in and how it feels as you breathe out. Notice the pace and the rhythm of your breath. Notice whether this changes, whether this stays the same. Just simply focus on each breath that comes in and out. Maybe notice the pause in between each inward and outward breath. And just stay there for a moment, observing your breath. It comes in, as it goes out, how your body feels. Just concentrate on that breath. You may notice thoughts coming in to your mind as you're concentrating on your breath. And that's okay, just notice them and then acknowledge they're there and bring your focus back onto your breath. And each time those thoughts come in, just bring yourself back, focusing on the rhythm of your breathing. Okay, and then when you're ready, just kind of open your eyes, bring yourself back into the room, and we'll move on in a moment. And just notice maybe how you feel having done that exercise. Okay. So when people are ready, I'm going to move on to just thinking about is that bit that we mentioned yesterday or last week, sorry, about the human brain, about that idea of the problem-solving brain and how useful it can be in terms of that idea of sort of the worry might be about what if I don't wake up tomorrow? Well, I can set an alarm, I can do things to solve it. And where the problems come is where there is no obvious solution. And I think the bit that we talked about was this one of what happens if I make my family ill? What happens if I bring us home? Which is a real worry for you all. And I think we really going to recognise that. So what we talked about is that worry and kind of where it can start from and how it can grow. So we talked about with the what if kind of brains, when there's no obvious solution, it can grow, it can lead us to catastrophize, it can lead us to sort of panic about the situation. So sort of what we're talking about is that idea of what if the lady I see has COVID-19, has coronavirus, is ill? What happens if I become a carrier and I don't know? What happens if I then pass it on to my family? And what happens if they become really sick? And it's really easy and quite understandable about how those worries can grow kind of and expand in our mind and lead us to feel highly anxious, lead us to feel kind of panicky, to feel like we're not in control, don't know how to manage it, how to solve it. So I guess the question is thinking about how can we manage it in the best way that we can, given that we are faced with this real worry, this illness. So I think what we're talking about is that it's understandable with that kind of pattern of worry that all these feelings, where we were talking about the anxiety, the panic, the guilt, the sadness, kind of the anger, can keep popping up quite normally when those thoughts are in there. And I think where, again, we talked about last week is the importance to acknowledge how we feel and try to kind of recognize those emotions, being present when they pop up and allow them to be there. So last week I mentioned the idea of the beach ball metaphor and how it's kind of far more exhausting if we try and fight them, push away those emotions, like trying to push a beach ball under the water, and actually how tiring, how exhausting that can be, and how much more of an explosion that can cause people, sort of. And you can really recognize it, sort of make the emotions feel so much more powerful when we do that. But actually, if we can sit and acknowledge those emotions and let them be there and be able to say that. And one way, sort of one of the things that kind of we can think of when we're thinking of those kind of really tricky thoughts where we can't manage those, sort of it feels so panicky, is about that idea of focusing on what we can do and reducing the risk. So one of the things that obviously creates the panic with COVID-19 is that there is a risk. We understand that that kind of risk is present, and that fear that we don't know who's going to get it. But I guess it's a little bit like sort of the idea of the crossing the road, that actually crossing the road is something we all do every day. When we do it, we've been taught the time to, and when we're young children, to look both ways, to wait on the side of the road, to find a crossing if we can, to make sure there are no cars coming. And we do everything kind of almost without thinking about it now to make sure that we can cross the road as safely as possible. And we know we can't eliminate the risk because of there, but we can take the steps we can take to try and make things safer. And I think it's the same with, similar with COVID-19. We can't get rid of the risk completely. We all know that that risk is present, but actually what we can do is to do everything we can to reduce the risk and to reduce being a carrier or reduce kind of passing it on. And these can include, as we all know, the washing your hands before and after seeing patients, the not touching your face during appointments and before you've washed your hands, the changing in and out of your uniform at work, so that you've got specific, and there will be specific measures, and I'm sure within each of your own trusts, about how to keep this as safe as possible. Some people, it might be really helpful to kind of identify and write down those things that might help you feel sort of specifically, so that that way you can feel that you have an element of control in this situation, which understandably feels quite scary, of actually, I know I am taking these steps, I know I am doing what I can to keep myself as safe as possible and to reduce that risk, which I know is present. And sometimes that can just be reassuring in itself to have those bits and recognize what you can control. The other bit we talked about last week with the way in which kind of emotions sit there and feel anxiety is actually with that acceptance, is being able to acknowledge and identify the emotions that you're feeling, putting in them to words. So for that example of kind of right now, I am feeling anxious about whether that is ill. Right now I am feeling really panicky about. And I think being able to name it to yourself is really helpful, so that you can understand how you're feeling and why you're worrying about it, or why you've got all these feelings inside you. I think the other part that's really important is actually you can name it to people around you. So you can talk to your colleagues about it, as they're likely to be feeling the same way. Actually being able to share the emotions is really important. Being able to express your emotions is really important. And also being able to share ideas about how you're managing it, how you're coping with it, what's helping you. Might be right, friends, your colleagues have other ideas about what's helping them. It may be about being able to acknowledge it, is talking to kind of managers, talking to those people that to find out what things they can put in to make you feel safer, to make you feel more protected and less anxious when you go to work. I think the other reason and the way to kind of being able to name it is also being able to name it to your family, to people that are around you, so that they can understand how you're feeling right now. And also perhaps being able to this can also prompt those conversations, bring up those conversations about how to best manage the situation at home. So having those, which might feel difficult conversations at times with your family, with the people at home, about things that you could put in place kind of to reduce the risk, to make you feel more comfortable, and for them to feel more comfortable about that risk of you bringing it into the home. And so obviously every family is different. Every family has different ways of working, different routines, different things that work, but it's about coming up with a plan that works for you, your family, but it's feeling able to have those open conversations to discuss what you perhaps need to do. I think there's something that some people kind of can be helpful, is this idea of looking at the facts or putting things in perspective. So obviously when we're sort of listening to the news, it is full of kind of details about the COVID infection rates, the death rates, about healthcare workers coming in, and obviously from kind of the last couple of days is also about Boris Johnson and the Prime Minister becoming ill, which really brings it home to us, how difficult this virus is. And I think we all recognise that, and I think the whole nation maybe is feeling much more anxious kind of and worried about it. But I think also that actually if we can put the news in perspective, what we hear about are those serious cases, and the deaths. And although it is really tragic, and there are deaths that people shouldn't have died, that we wish they hadn't, that if we could change it, we could get rid of it, we would kind of stop it. But what we know, the fact suggests, is that actually the majority of people will have mild symptoms. We just don't hear about the majority of those symptoms of those people, because it's not possible to test them, it's not possible to know kind of the rates. Figures suggest, if you look at the kind of death rates versus those with confirmed cases, that sort of death rates are at about 5%. But what we know is that those confirmed cases are only those that present at hospital, that the likelihood is there are huge amounts within the population that have got it that aren't ever going to know that they've had it. So they think that sort of death rates are around about sort of possibly by the end of this will be about 0.5 to 1% of those that catch the COVID-19, and that by the end of this it'll be somewhere, depending on the numbers, between about 0.02 and 0.3 of the total population. And whilst obviously, like I said, that is kind of tragic, and those percentage, whoever, would be people that their families, it's awful, and it's really distressing, and I don't want to take away from that, because actually each individual death is a death too many. But I think being able to recognise the rough kind of numbers and what it's like is important as well. That I think the other bit is that what we are doing is all changing our behaviours to keep those numbers as low as we possibly can, to try and to do everything we can. And that's where that control bit is, that we have all changed our behaviour dramatically to try and do everything we can to reduce those numbers. So for some people, and this isn't something necessary to get so caught up on, I don't want people to get into a battle in their heads with that, but actually it can be helpful to try and put things in perspective when we can hear, all we hear about are the deaths and the deaths and the deaths. But also, I mean, one thing might be to consider for you as an individual is whether actually it's helpful to kind of reduce your media exposure, how much you look at the news, whether you set it at certain times of once a day to keep an abreast without feeling overwhelmed by it. Because I think sometimes when we're hearing those deaths constantly and the rates, it can increase our anxiety rates and make us feel a lot worse about it and a lot more panicky about how we manage it. So just thinking kind of about these worries and the idea of actually putting things in perspective, but also how we can control things. I guess it's that if we start with each of them, it's that, what if this lady I see has COVID-19, which could quite often come up before you have an appointment, is actually that idea of, I know I am doing everything I can to be safe in the appointment. And it may be that for you, you have a policy that you check out before you see somebody if they've had any symptoms, got any symptoms, if anything's changed for them, to keep yourself safe in that way. The sort of, what if I become a carrier? It's about that I have continued to do everything I can to avoid catching it, to avoid this, to make sure I keep myself safe. And that, I guess, going back to that bit, is that what we don't even know is whether that lady's got it. So at each stage, kind of that risk be coming down. I guess, what if I pass it on to the illness? Again, we have put plans in place at home to reduce the risk of this happening, but also that point and say, you don't even know if I'm carrying the disease. And that's what happens if I become really sick. It's that knowledge that actually, you know, you're doing all you can to help reduce this risk of this happening. So holding on to those thoughts. And I think it can be helpful to remember that. What I guess I wouldn't want people to do is to get into that kind of battling when that anxious thought comes up, of battling with that and trying to reassure yourself if it's not helpful. But for some people, just being able to say that to themselves, hold that in mind when that thought comes up, can be useful. Okay. And that idea of remembering that actually most people have mild symptoms. So I suppose what that in kind of summary is thinking about is when those thoughts pop up, is being able to kind of recognize that, how are these thoughts helpful for me right now? So yes, because they enable us to put measures in place to reduce the risks for myself and my family. If we didn't feel that anxiety, if we didn't care, if we didn't worry, actually none of us would be changing our behaviour. And that's when the situation would obviously get far worse. So those thoughts are really helpful because they enable us to act in some way. I guess the other bit is, are those thoughts help me right now? No, if they're increasing my level of anxiety and making me find it difficult to cope. And so if it's that sense of, right, I have done everything I can to be in control, to manage this, to put every measure in place to keep the risk as low as I possibly can. Those anxious thoughts might still come, but actually that's when we talked about before about that being able to kind of let them go. So that idea of them being on the leaves on a stream, and they can come in and seeing it, sort of letting them float away and letting that sense of anxiety just bob around you. And where we talked about was that idea of, again, and a bit like we did the mindfulness exercise, when those thoughts are there, the idea is actually right now they're not helpful for me, or they're creating this sense of panic. That's when you can bring yourself back into the present moment by doing sort of various exercises, and we discussed some of these last week. So the noticing what's around you, the mindfulness breathing exercise that we've just practiced, that sense of connecting with your physical body, so grounding your feet into the floor, pushing your fingers together, stretching your arms up, moving your arms and just reconnecting and bringing yourself back to your physical body. And another one, and maybe over the weeks we can kind of practice this one, is just the body scan, where you can just, if you find yourself again in a comfortable position, and just move your attention slowly through different parts of your body, starting from the top of your head, and just notice what is happening, how things are feeling in your head, what your mind's doing. You're not trying to change anything, you're not trying to relax it, but you're just gradually kind of working your way down through your body. So noticing your shoulders, whether there's any tension, whether they're relaxed, your arms, and working your way sort of gradually all the way down to your toes. Like I said, that might be one to try out another week, but it's just another exercise that's a possible one to try to sort of bring yourself back into the present moment, a moment where we can just let those thoughts go and give ourselves a break. Another bit for me, which I think kind of important, is also that bit we talked about, the kind of the values, and identifying what you are doing, what's important to you, and how you are still able to put those values into place despite kind of the anxiety, despite the fear of your family. And I think a lot of you, I will read this out because I don't know how easy it is to see depending on what you're watching, but I think that I wonder whether for midwives actually caring is a value that's kind of important for a lot of you and might be why you came into the profession. And a friend of mine who's a midwife in Devon posted this on her kind of Facebook page. She didn't write it, but another, I don't know who wrote it, but it was obviously from another midwife, which I think just encapsulates to me what an amazing kind of role midwife, you as midwives do, and how important it is to kind of recognize that the caring what you provide. So I will read it out for anybody who can't see it. It just says, a midwife's role is to be with women. It is the very essence of everything we live and work for, with women. It means that even when COVID-19 makes its rude entrance and disrupts your pregnancy and birth plan, we will be there to talk it all through with you, to try our best to put you at ease and to tell you about your new birthing options and find the best path for you. It means that when you are forced to birth in a place that you hadn't planned, maybe at home, maybe in hospital, that we will give you the tools you need to come to terms with this and process the last minute change. It means that when you face the prospect of birthing without your partner next to you, that we step up and hold your hand so that you know you're not alone, because you're not alone. We know you're frightened, and the truth is, we are too. None of us really know what to expect when we enter those maternity wards, but you are strong and powerful, and we are trained and skillful, and the combination makes the birthing a perfect duo for birthing and caring for a new baby. We will be your cheerleader when the going gets tough, and your gentle support when you need some reassurance and encouragement. We will cry with you, laugh with you, share with you and care for you throughout the whole of your pregnancy, birth and beyond. We will be your advocate, your protector, your defender, your friend. We will be everything you want us to be and more. We will go above and beyond for you because during our shift, you mean everything to us. We'll help you guide your baby out safely, help you feed them, dress them, change their nappies and learn all the skills you need to confidently care for them. We'll help you mobilise, change your catheter bags, change your pads, help you wash and shower you with all the love and praise you deserve after your huge achievement of bringing new life into the world. We'll help you realise just how incredible you are. We know we cannot take the place of your birthing partner, and we do not wish to try, but we want you to feel safe and have a positive birth experience regardless. We want you to know that whilst you may be on your own, you are not alone. So whilst many things are changing within maternity right now, one thing will forever remain the same, that beneath these goggles, masks, aprons and gloves, us midwives will continue to do the one thing that runs through our blood. We'll continue to be with women, and we'll offer our hearts and our hands to every mother and mother-to-be we meet. Please do not be afraid. you can count on us. We'll always be there. I mean, some of you may have seen that already. I don't know how much has been going around, but to me, I think that just shows, you know, the kind of the bravery, the sense of actually what you do as a kind of job, and it's giving yourself how amazing you are, the things you put yourself through, and actually giving yourself that credit and knowing that you are doing your best in a difficult, really difficult situation, and to be able to kind of be proud of yourself for doing that. And I think that the other bit alongside that is the kind of care you give to women, which is just fantastic and amazing. And keeping that in mind when you are struggling is that you are continuing to do your best, but also that importance of the caring for yourself, because yes, you are continuing to care for women. You are doing an incredible job in what is really difficult circumstances and making a difference for those women around you. But also, and so it's really important to give yourself that credit, but it's also really important to give yourself that same kind of loving care. That actually, and going back to that, Patty, I think one of the things that was really important to me was that recognition of actually, as the midwives, you are frightened too, and that's understandable that you don't know what to expect. And so you have to give yourself that downtime, to give yourself that break from work, yourself the break from anxiety, from COVID-19, when you are home, to hold in mind that actually, yes, this is anxiety provoking, but I have done everything I can to keep myself safe, and I can care for myself. And it's finding those things that help you unwind. So be it the kind of the bubble bath, the getting some exercise, gardening, reading, whatever it is that helps you to switch off, that's really vital. Take that time for you, because we know those anxieties are present. We know we have to sit with them, and it's finding the best ways kind of to manage them and to let yourself have a break from them. So I guess just in kind of summary, that the anxiety, I think, about taking this illness home and the worry about it is understandable. When you're on the front line, it's one that's there. It will bring up a lot of anxious thoughts, and they are likely to kind of escalate, as we mentioned, and they can escalate. But it's important to be able to recognize those emotions as they come up, accept them, allow them to be there, identify what you are doing to reduce that risk, to bring that risk down, because that's what we can do. That's the bit we can control. We can manage that risk. Help to acknowledge and name those emotions that you're feeling, talking to other people around you, the colleagues, the managers, your family. Put those plans in place to try and reduce those risks. Can be helpful to either reduce your immediate exposure or to be able to put things in perspective, the numbers. When things get, and recognizing that idea of actually these anxious thoughts are really helpful to make sure I put in place all those safety measures that I need to do, but actually they can also get too much. And that's when it can be things like coming into the present moment and doing those exercises, acknowledging what you do, the care you give, and also the caring for yourself and enabling yourself, allowing yourself to have breaks and stop. I think those are the main kind of bits. As we mentioned, again, there are a few resources available. These are the first three are ones that we mentioned last week. So the Mind website, the Headspace for Work, if anybody's not heard of it, that there is, if you Google that, or you can get free access for the NHS. There's also a link to some more specific mindfulness breathing exercises, and then Jules has kind of kindly forwarded some specific hypnobirthing relaxation scripts which are available, which are specifically done for midwives in this time, and so people might want to check those out as well. And there may also be, it might be worth asking, I know Southampton, you've Jill sent forward, and I wasn't sure how to put it on, but a support service that's available, or they're looking at developing a support service, I think, for people. And I know within Southern Health we have a what they call a listening ear, where you can pick up the phone and speak to somebody if you're kind of after a shift or if you need some support. So it might also be worth just checking around in your trust about whether there's anything like that available if you need it. And yeah, that's the end. Sort of thank you kind of for listening, and if we welcome to kind of question